Hello and welcome to INTD 435, Introduction to Palliative Care. The purpose of this presentation is to give a general overview of the course and its content. The topics in this presentation are shown here. First, we'll discuss the course goals and student learning outcomes. We'll discuss the focus of the course and who can benefit from its content. Then we'll review the module topics, review the teaching learning strategies, and describe the different types of assignments that you'll have in this course, describe how to find the rubrics, give some pointers on how to approach the course, discuss what resources are available within the course, and provide guidelines on how to be successful in the course. First, almost everything you need to know about the course can be found in the syllabus. A lot of times if you have a question, you'll find the answer in the syllabus, so that's your first go-to place for the course. What you'll see when you open the syllabus is a table of student learning outcomes. In general, the goals of this course are to introduce the concepts of palliative care and approaches that beginning providers can take in seeing their palliative care patients. This is an interdisciplinary approach to the patient. Although the resources we're using in the course are primarily those from nursing, they can be applied by anyone. The palliative care approaches will focus on multiple settings, including home, acute care, long-term care, and so forth. You will learn enough in the course to know how to find what you'll need for your specific practice. You will not be by any means an expert in palliative care, but you will know enough to know where to find the information. The focus in this course is on palliative care, not so much hospice or death and dying, although we do also discuss those issues. There are 2 textbooks for the course. Again, this information can be found in the syllabus. The first one is the Palliative Care for Nursing textbook. It is an excellent resource and it's very thorough. It is quite large, but I hope you find it useful. We will not cover all of the chapters in there, but again, there will be good resources for you to link you out to other resources as well. And of course, like all of our courses, we also require any writing to conform to APA format, and therefore the other course textbook is the APA Manual 6th edition. In addition to the textbooks, there will also be other resources within the modules. Some of these will be videos for you to watch. Some will be additional readings from other sources that are not the textbooks. Some will be websites that you'll need to visit. And it won't necessarily be limited to those things, but you will be using a variety of source types in addition to the texts. The course will be taught by modules. There are 6 modules in this course. The topics are shown here, and following completion of the learning activities within the 6 modules, you'll get to pull it all together into a final paper where you develop a care plan that for a case study that would show how you would coordinate care of that palliative care patient. The first module will review the meaning and history of palliative care, hospice, and end of life. In the second module, we'll discuss ethical issues, primarily patient autonomy. And then we'll move on to symptom management. The most obvious symptom to be managed in palliative care patients is pain, which has quite a few issues associated with it, including some of its own ethical issues. Then in the next module, we'll talk about some of the other symptom management symptoms that need management. These will not be every symptom that you will encounter in palliative care patients, but they will be some of the more common symptoms that are in addition to pain. The 5th module will focus on interprofessional care, culture, and communication with patients. And then the final module will talk about bereavement, and then professional growth and care of yourself as one who provides care to palliative patients. You'll be doing several types of assignments throughout the course. They'll be spread throughout the module according to the course schedule. The course schedule is one of those documents you can see from the course overview content area of Blackboard. You should also see the syllabus for a description of the assignments as well. The assignments will also be described within the individual modules in which they fall, and you can tell by looking at the course schedule also where they fall in the modules and where they fall in the calendar date. The types of assignments are discussion boards, QSGAs, quizzes to which you contribute, and a scholarly paper, which is the final assignment. Discussion boards are forums where I will post an initial prompt and you'll need to respond. I'm hoping that you've all participated in these in some of your other courses. The QSGAs are probably a little bit different than what you've seen before. That's a little acronym for question and study guide assignments. In there you will be creating quiz questions and a study guide to go with them. And my goal is to actually use those to create the quizzes, primarily to create the quizzes. If all the topics that are important don't happen to be covered by the questions that you as a group create, of course I will add some of my own, but here you have a lot of opportunity to direct your own learning, which is great. Then the scholarly paper is the final assignment, which I mentioned earlier. You'll create a care plan that goes with a case study that I post, and you will get to draw on everything else you've learned in the course. Although it's a care plan, you will need to write it in scholarly format, so if you're a little weak on APA format, be sure to access all the resources that are available in the course, and those will be discussed later. Now I want to say a little bit about plagiarism. Plagiarism is one of those prickly issues that nobody wants to admit goes on, but unfortunately does happen more often than we think. Plagiarism can be done inadvertently, by accident, or in its worst case, it is theft. Be sure to review the student handbook for what plagiarism is, and do the plagiarism quiz and certificate so that you can be sure that you know what plagiarism is, so that you don't mistakenly plagiarize somebody when you did not mean to. And plagiarism is very serious. If we do suspect plagiarism, we will pull you aside and talk with you and follow up as necessary. We do use Turnitin, which is plagiarism detection software, and that information is shown elsewhere in the course. Okay, so please be careful with your writing. Every assignment has a rubric that forms the basis of the grade for each assignment. The rubric should not be viewed as your enemy. In fact, the rubric is your friend. It can be used as a guide for doing the assignments. Especially for the papers, scholarly papers, the rubrics are laid out as we expect the sections to be laid out. So as you're writing your paper or completing your assignment or doing your discussion board, be sure to have the rubric out in front of you to make sure you cover all the bases. So here are some pointers on how to approach the course. First of all, be sure to put enough time in your schedule so that you have time to actually do the coursework. Be sure to allow at least 5 hours a week for this course. It's a 3-credit course. If you were taking it in the classroom, you would be in the classroom at least 3 hours a week, and most people put in another 2 hours for every 1 hour they're in the class, so that would really be 9 hours a week for a 3-credit course. We know from the research that most online learners do not dedicate that much time to their coursework, but please be sure that you've allocated yourself enough time to do a good job on the learning activities and on the assignments. I have found it helpful in the past if I set aside a specific time, every week, say every Monday at 5 o'clock or whatever, but everybody's different, so just be sure to allow yourself time and to make sure it's more than one session. You cannot do an entire module in one sitting. The modules are set up to be on the calendar per the course schedule, so be sure to know that. Modules will open on Blackboard. You'll be able to see them at least a week before the official open date that's shown on the course schedule. And once they're open, they'll remain open through the end of the course. so that you have access to all the materials. Once you open a module, when you first open it, scan through the entire module to see what's there, what the learning activities are, and what the assignments are. Each module will contain a how to approach this module narration PowerPoint like this. Understand what is expected for each assignment. Look at the rubrics and look at the due dates. And for the QSGAs in particular, make sure you base those on the materials that are specified. Not everything in every module is fair game for a QSGA. Then, and only then, go ahead and do the learning activities, the readings, the videos, whatever. Be sure you're actively learning during these activities. Take notes, underline, have a little voice recorder out, make flashcards, whatever, so that you're doing something while you're doing the learning activities. That way you'll be able to retain the material. Then do the assignments, or as you're going through, once you know enough to do the assignment, go ahead and start it. When you're doing an assignment, make sure to leave yourself enough time to proofread and double check yourself. Some of these are going to be seen by everybody in the discussion boards. Many of them only I will see. But still, do your best work. So leave yourself enough time to proofread and double check what you do. And there are some quizzes, as I mentioned earlier, in the course. So be sure to look on the course schedule and see when those will be open and set aside time in your schedule for those. I know everybody works quite a bit. The quizzes will remain open for 4 days, and just be sure to allow yourself a good chunk of time during those 4 days to start and complete each quiz. The course contains several resources to help you succeed. There's a helpful tools folder at the bottom of the learning modules, and that's something I created. It's a collection of videos and helpful hints that I made that I've seen students struggle with. And so I want to forestall you're having the same struggles. Also, if you look at the content areas along the left-hand side of the Blackboard screen, you'll see some things like help with writing, technical support, library link. Explore those. There is a lot of good, helpful information in there for you to access. Most of your courses through the College of Nursing should have similar links. Also, if you're from the College of Nursing, you should have been enrolled in a Con 301 course. Take a look in there. There are many, many, many good resources in there about statistics and research and just online learning in general. So please take note of the resources and utilize them as you need them. So what's the best way to be successful in the course as you go through the different modules and all the various materials that are provided? First and foremost, it is very important to understand the syllabus. A lot of the what you need is in there. In fact, almost all of what you need is in there. It lays out the course expectations, it talks about the assignments. The rubrics are not in the syllabus, however, and there's an introductory video on Blackboard that shows you how to access the rubrics from your gradebook. Fully digest the course schedule. That's what the other document I mentioned that you can get from the course overview area. It has calendar dates and shows when each assignment is due. This will help you stay on track. The worst thing you can do is get behind. The course is very doable as long as you stay up to date and on track on it. As I said, understand the syllabus. You'll see a recurring theme here. Consult the syllabus first if you have questions. Ask a question is a discussion board we have in Blackboard. That's the equivalent of you raising your hand. And if you subscribe to the discussion forum, you'll get an email every time something new is posted there, so you'll be able to keep up on what people are asking and what I'm answering, and you can talk to each other through there too. And last but not least, understand the course schedule and the syllabus. Okay, so take a look at the course materials, get going, and I hope you enjoy the course.